Imagine this. You have had the same Medicare Advantage plan for years. You know your doctors, you know your copays, you know which pharmacy to go to. Everything is familiar, everything is routine. Then one day you open your mailbox. There is a letter from your insurance company. And it says your Medicare Advantage plan will no longer be available in your area. Just like that. No warning you expected, no explanation that makes sense. Just a letter telling you that the plan you have relied on for your healthcare is going away. Your stomach drops. You think, what happens to my doctor? What happens to my prescriptions? What happens to my dental coverage, my vision coverage, my hearing benefits? What happens to me? And then the worst thought creeps in. What if I get sick and I do not have the right coverage? If this has happened to you, or if you are worried it could happen to you, I need you to listen very carefully to everything I'm about to say in this video, because what you do in the next few weeks could protect you, and what you fail to do could cost you thousands of dollars, or even lock you out of affordable health coverage for the rest of your life. That is not an exaggeration. That is federal law. And I am going to explain every piece of it to you today in plain simple English. I am Masha. I am a senior policy analyst and retirement finance expert right here on TaxWise Seniors. And my job is to take these complicated government rules and break them down so you can actually understand them and protect yourself. In this video, I am going to tell you exactly why millions of seniors are losing their Medicare Advantage plans in 2026. I am going to explain the official rules from Medicare.gov that determine what happens to your coverage when your plan disappears. I am going to walk you through your options step by step, and I am going to reveal the 4 hidden traps that catch seniors off guard, including one mistake that can permanently lock you out of supplemental coverage for life. Please stay with me until the very end of this video, because the most important information, the one deadline that most seniors do not know about, comes later, and missing it is something you cannot undo. Let us start with what is actually happening right now. According to the Kaiser Family Foundation, which analyzed official data from the Centers for Medicare and Medicaid Services, approximately 2.6 million people are enrolled in a Medicare Advantage prescription drug plan that has been terminated for 2026. That means their plan simply will not exist anymore. It is gone. Let me say that number again. 2.6 million people. That is 13% of all individual Medicare Advantage enrollees with drug coverage, and it is double the number from last year. In 2025, about 1.3 million people were affected. This year, it doubled. On top of that, another 1.3 million people are in plans that went through something called a consolidation. That means they were not dropped entirely. Instead, their insurance company moved them into a different plan, automatically under the same company. But that new plan may have different doctors in the network, different copays, different drug coverage, and different costs. So even though they were not technically dropped, everything about their plan may have changed. Now here is what is driving all of this. The biggest insurance companies in the country are pulling out of counties where they are not making enough profit. UnitedHealthcare, the largest Medicare Advantage carrier in America, exited 225 counties. They only entered 14 new ones. Humana exited 198 counties and entered 5. Elevance left 181 counties. CVS Aetna left 160. And in some places, there is nothing left. In 2026, 122 counties across 13 states have 0 Medicare Advantage plans available for individual enrollment. 0. Those states include Alaska, California, Colorado, Idaho, Kansas, Minnesota, Montana, Nebraska, Nevada, Oregon, South Dakota, Utah, and Vermont. Nearly 400,000 seniors in those counties have no Medicare Advantage option at all. Vermont was one of the hardest hit. Vermont Blue Advantage, which is Blue Cross Blue Shield of Vermont, pulled out completely. UnitedHealthcare pulled out too. The only insurer left is Humana, and they only offer plans in 5 of Vermont's 14 counties. The other 9 counties have nothing. So if you live in one of those areas, you do not have the choice of switching to another Medicare Advantage plan. Your only option is Original Medicare. And that comes with a completely different set of rules, costs, and risks that you absolutely need to understand. Now, let me tell you about someone I will call Margaret. Margaret is 71 years old. She lives in a small town in New Hampshire. She has been on the same Medicare Advantage plan for 6 years. She loved it. $0 monthly premium. Her copays were small and predictable. She had dental coverage, vision coverage, a hearing benefit, and even a small allowance for over-the-counter medications like vitamins and bandages. She had a gym membership through the plan. Her doctors were all in network. Then last fall, she got the letter. Her plan was leaving her county. Margaret was confused, but she was not panicked. She figured she would deal with it later. She thought, well, Medicare will take care of it. They will put me into something. And technically, she was right about one thing. When her plan ended on December 31st, Medicare did automatically enroll her in Original Medicare, Parts A and B. But here is what Margaret did not understand. Original Medicare is not the same as Medicare Advantage. It does not work the same way, and it does not protect you the same way. Under Original Medicare, Medicare pays 80% of approved outpatient and physician costs after you meet the Part B deductible, which is $257 in 2026. You are responsible for the other 20%. That is called coinsurance. And here is the part that shocks most people. Under Original Medicare, there is no annual out-of-pocket maximum. None. There is no cap on what you could owe in a year. With her old Medicare Advantage plan, Margaret had a maximum out-of-pocket limit. Once she hit that number, the plan covered everything else. That number might have been $4,000 or $5,000 or even $8,000 depending on the plan. But there was a ceiling. With Original Medicare alone, there is no ceiling. So if Margaret has a health emergency, say a $100,000 cancer treatment, she would be responsible for $20,000 out of her own pocket. If she needs a $250,000 surgery and hospital stay, she could owe $50,000. And Margaret is living on Social Security and a small pension. She does not have $50,000. But it gets worse. Margaret also did not realize that Original Medicare does not include prescription drug coverage. Her old Medicare Advantage plan bundled everything together. Her drugs, her doctors, her hospital coverage. It was all in one plan. Now she has no drug coverage at all unless she signs up for a separate standalone Part D plan. And Margaret takes 5 medications every day. One of them is expensive. She went to her pharmacy in January to pick up her prescriptions. And the pharmacist said, "You do not have drug coverage." Margaret was stunned. She thought Medicare covered her medications. She did not understand that Original Medicare, Parts A and B, does not cover outpatient prescription drugs. You need Part D for that. And she never signed up for a Part D plan. Now she is paying full retail price for her medications out of pocket, and none of that spending counts toward any out-of-pocket cap because she is not enrolled in a Part D plan. But the story still gets worse. Because of a second mistake Margaret made. Margaret also lost her dental coverage, her vision coverage, her hearing benefit, her gym membership, and her over-the-counter allowance. All of those were extra benefits that came with her Medicare Advantage plan. Original Medicare does not cover routine dental. It does not cover routine vision. It does not cover hearing aids. Those benefits simply do not exist under Original Medicare. Margaret did not know any of this until it was too late. And the biggest mistake of all, the one that cannot be undone? Margaret waited too long to buy a Medigap policy. Let me explain this very carefully because this is the most important part of this entire video. A Medigap policy, also called Medicare Supplement Insurance, is a separate policy you buy from a private insurance company. It helps cover the costs that Original Medicare does not pay, like that 20% coinsurance, copays, and deductibles. If Margaret had bought a Medigap policy, like a Plan G, she would have been protected from those massive out-of-pocket costs. Plan G covers almost everything Original Medicare does not, except for the Part B deductible. But here is the rule that catches people. You cannot just buy a Medigap policy whenever you want. Under federal law, your best opportunity to buy a Medigap policy is during your Medigap open enrollment period. That is a one-time 6-month window that starts the first month you are both 65 or older and enrolled in Medicare Part B. After that window closes, in most states, insurance companies are legally allowed to deny your application based on your health. They can charge you more because of pre-existing conditions, or they can refuse to sell you a policy at all. This is called medical underwriting. But here is the critical exception that applied to Margaret, and that applies to you if your Medicare Advantage plan was terminated. Under federal law, if your Medicare Advantage plan leaves your area, stops offering coverage, or has its contract non-renewed, you have what is called a guaranteed issue right. This is a powerful legal protection. It means an insurance company must sell you a Medigap policy. They must cover all of your pre-existing conditions without any waiting period, and they cannot charge you more because of your health history. You can buy Medigap Plan A, B, D, G, K, or L. If you were eligible for Medicare before January 1, 2020, you can also buy Plan C or Plan F. But here is the catch, and this is what Margaret missed. You must apply for that Medigap policy within 63 days after your Medicare Advantage coverage ends. You can start applying as early as 60 days before your coverage end date. But after that 63-day window closes, your guaranteed issue right is gone. In most states, it is gone permanently. That means if you have diabetes, heart disease, a history of cancer, COPD, or any other pre-existing condition, you may never be able to buy affordable supplemental coverage again. Margaret did not know about the 63-day deadline. She waited 3 months. By the time she called an insurance company to buy a Medigap policy, they ran her medical history and denied her application. She has diabetes and a prior heart condition. She is now on Original Medicare with no Medigap supplement, no drug coverage, and no cap on what she could owe. And that is the situation I do not want you to be in. Now, I know some of you listening right now might be thinking, okay, Masha, but my plan was not terminated. My insurance company moved me into a different plan. I got a new plan automatically. If that happened to you, you went through what is called a consolidation. And I need you to pay very close attention to this. When your plan goes through a consolidation, the insurance company puts you into a different plan under the same company. It happens automatically. You did not choose it. And here is the problem. That new plan might have a completely different provider network, which means your doctors might not be included anymore. It might have higher copays. It might have a higher maximum out-of-pocket limit. Your prescription drugs might be on a different tier, which means they cost more, or your drugs might have been removed from the formulary entirely. And here's the part that is truly unfair. If your plan was consolidated, you do not automatically get the same guaranteed issue right to buy a Medigap policy that people with terminated plans get. So you are in a new plan you did not choose, with potentially worse benefits, and you do not have the same federal protection to leave and buy supplemental coverage, but you are not without options. If you are in a Medicare Advantage plan right now and it is not working for you, the Medicare Advantage open enrollment period runs from January 1st through March 31st every year. During that window, you can switch to a different Medicare Advantage plan, or you can drop your Medicare Advantage plan and go back to Original Medicare and enroll in a standalone Part D drug plan. However, and this is important, dropping your plan during the Medicare Advantage open enrollment period does not automatically give you Medigap guaranteed issue rights. You would only have guaranteed issue if you qualify under a separate trigger, such as being within 12 months of joining a Medicare Advantage plan for the very first time, which is called a trial right. If you are unsure whether you qualify, call your state insurance department. Or better yet, call your SHIP counselor. I will explain what that is in a moment. Now let me talk about the prescription drug trap, because this one catches people every single year. When you switch from one plan to another, or when you move from Medicare Advantage to Original Medicare with a standalone Part D drug plan, your new plan has a completely different formulary. A formulary is the list of drugs that the plan covers. Each plan creates its own list, and each plan decides which tier each drug goes on. Tier 1 is usually the cheapest. Tier 4 and Tier 5 are the most expensive. Here is what can happen. A medication that was covered on your old plan with a $30 copay might be on a higher tier on your new plan with a $150 copay. Or it might require prior authorization, meaning your doctor has to submit paperwork and get approval before the plan will pay for it. Or it might require step therapy, which means the plan forces you to try a cheaper drug first before they will cover the one your doctor actually prescribed. And in the worst case, your medication might not be on the formulary at all. If your drug is not on the formulary, you pay the full retail price out of your own pocket. And here is the kicker. That money you spend on off-formulary drugs does not count toward your $2,100 annual Part D out-of-pocket cap. Let me say that again because it is so important. The $2,100 cap that limits your annual drug costs in 2026 only applies to drugs that are on your plan's formulary. If the drug is not on the list, you pay full price, and there is no limit on what you could spend. So before you enroll in any new plan, you must check the formulary. Go to Medicare.gov, use the Plan Finder tool, enter every single medication you take, see which plans cover your drugs, what tier they are on, and what the copays or coinsurance will be. Do not assume your new plan covers the same drugs. Check it yourself. Now, I also need to tell you about the Part D late enrollment penalty because this one is permanent. If you go 63 continuous days or more without Part D drug coverage or other creditable drug coverage, you will face a late enrollment penalty. This penalty is added to your Part D premium every single month for as long as you have Part D coverage. It never goes away. The penalty is calculated as 1% of the national base beneficiary premium, which is $36.78 in 2026, multiplied by the number of full months you went without coverage. So if you go 12 months without drug coverage, your penalty would be about $4.41 per month added to your premium permanently. And that number goes up every year as the base premium increases. Over 10 or 20 years, that adds up to hundreds or even thousands of dollars in extra premiums, all because you did not sign up for a drug plan in time. When your Medicare Advantage plan is terminated, you do get a special enrollment period to join a standalone Part D plan. For plans whose contracts are non-renewed, this SEP runs from December 8th through the last day of February. Use it. Do not let it expire. All right, I have given you a lot of information. Let me now pull it all together with the 3 most important steps you need to take if your Medicare Advantage plan has been dropped or changed. Step number 1. Find out exactly what happened to your plan. Did your plan get terminated, or was it consolidated into a different plan? This matters because it determines your rights. If it was terminated, you have a guaranteed issue right to buy a Medigap policy. If it was consolidated, you may not have that same right. Look at the letters and notices your plan sent you. Look at the annual notice of change you should have received by September 30th. If you are not sure what happened, call 1-800-MEDICARE. That is 1-800-633-4227. Tell them your plan name and ask them what happened to it for 2026. They can tell you. Step number 2. Take action before your 63-day deadline expires. If your plan was terminated and you want to go to Original Medicare with a Medigap supplement, you need to apply for that Medigap policy within 63 days of your coverage ending. Do not wait. Do not put it off. Do not assume you can do it later. Contact insurance companies in your state that sell Medigap policies. You can find them at medicare.gov/Medigap. Compare prices for the same lettered plan from different companies. The benefits are identical across companies for the same plan letter. The only difference is the price. Most experts recommend Plan G as the best value for people new to Medigap, but your SHIP counselor can help you compare your options. And make sure you also enroll in a standalone Part D prescription drug plan so you have drug coverage. Use the Medicare Plan Finder to compare plans and check that your medications are covered. Keep copies of every single letter, every notice, every email, and every postmarked envelope related to your plan termination. You may need these documents to prove your guaranteed issue right when you apply for Medigap. Step number 3. Call your SHIP counselor for free, personalized help. SHIP stands for State Health Insurance Assistance Program. Every state has one. It is funded by the federal government, and it is completely free. SHIP counselors are not insurance agents. They do not work for any insurance company. They are not trying to sell you anything. They are trained to help you understand your Medicare options, compare plans, check whether your medications are covered, and make sure you do not miss any deadlines. You can reach your SHIP counselor by visiting shiphelp.org, or you can call 1-800-Medicare, which is 1-800-633-4227, and ask to be connected with your local SHIP. If you have limited income, ask your SHIP counselor about 2 programs that can dramatically reduce your costs. The first is called Extra Help, also known as the Low Income Subsidy. It helps pay your Part D premiums, deductibles, and copays. The second is called the Medicare Savings Program. It can pay your Part A and Part B premiums and other costs. You can apply for Extra Help through Social Security at ssa.gov or by calling 1-800-772-1213. These programs exist to help you, but you have to apply for them. No one will sign you up automatically. Now, before I close, let me recap the 4 traps I talked about today, because I want to make absolutely sure you remember them. Trap number 1, doing nothing and assuming Medicare will take care of everything. If you do nothing, you end up in Original Medicare with no drug coverage, no cap on your out-of-pocket costs, and no supplemental protection. That is dangerous. Trap number 2, thinking you can buy a Medigap policy whenever you want. You cannot. In most states, after your 63-day guaranteed issue window closes, insurance companies can deny you based on your health. This mistake can be permanent. Trap number 3, assuming your new plan covers the same medications. Every plan has a different formulary. Check your drugs before you enroll. If your drug is off formulary, you pay full price with no cap. Trap number 4, missing the deadline and thinking you can fix it during open enrollment next fall. Open enrollment lets you change Medicare Advantage and Part D plans. It does not give you guaranteed issue rights to buy a Medigap policy. If you miss the 63-day window, in most states, that protection is gone. Now, I want to speak to you directly for a moment. I know this is overwhelming. I know the language is confusing. I know the deadlines feel impossible to keep track of. And I know that some of you are watching this right now feeling scared. That is okay. The fact that you are here, watching this video, learning about your rights, that already puts you ahead. Because millions of people are going through this right now and they have no idea what their options are. You deserve to understand the rules that affect your healthcare. You deserve to know your rights. And you deserve to have someone explain it in a way that actually makes sense. That is what we do here at TaxWise Seniors. Every week, I break down the rules that affect your Social Security, your Medicare, your retirement savings, your insurance, and your financial security. If you are not already subscribed, please subscribe right now and turn on that bell notification so you do not miss a single video. But I also want to be honest with you. YouTube notifications are not always reliable. The algorithm does not always show you our videos. And some of the changes that affect your benefits happen fast. Faster than we can release a new video. That is exactly why we created the Global Senior Alerts official WhatsApp channel. It is a free channel where you can get real-time alerts about Social Security changes, Medicare updates, pension rules, bank regulations, insurance policy changes, and travel rules for seniors. When you join, you can also download our free Senior Benefits Protection Guide. It has the key deadlines, phone numbers, and websites you need all in one place. Click the link in the description below this video to join the WhatsApp channel right now. It is free. It takes 10 seconds. And it could be the thing that keeps you from missing a deadline that changes your financial life. I am Masha. Thank you for spending this time with me today. Take care of yourself, and I will see you in the next video.